Hello again, everyone. Dr. Dan Bockmann here. Today we're going to talk about something that a question I get commonly, and that is about a swayback. So if you don't know what I'm talking about, when people talk about a swayback, they're talking about the curve in your lower back, the kind of scooped out area there. And they're concerned that, hey, is my curve too big? So let's talk about that. So first of all, having a little extra curve in your low back is not automatically a bad thing, but it can be caused by a couple of problems that we may want to fix. But first of all, let's go over a little spinal anatomy. So essentially, when viewed from the side, our spine should have a curved shape, kind of an S shape. So you've got a scooped in area in your low back. In your upper back, you have a kind of more curved outward area, and then in your neck, of course, it recurves back again. And what that effectively creates is a spring which allows our body and our spine to absorb impact a little better, and because of the way we're assembled, it allows movement to happen more easily. And it lets our joints, our vertebrae, and our discs and so on fit together better. Now, so it's normal to have some curve there. And some people are just assembled a little differently than others, meaning some people are just naturally born and assembled with a less pronounced curvature, and some have a little bigger curve there. So little anatomical variations from person to person are fine. However, what I care more about are acquired excessive curvature, meaning it's something you didn't used to have, but it's become more apparent, or it's progressed as you've gotten older, especially if you're having back pain that goes along with this. So first of all, what a curvature can mean, we call that curve a lordosis in the lower back. So the scooped out area in your low back is a lordosis, the upper back is a kyphosis, and then again you have another lordosis in your neck as well. So if you have too much curve in your low back, known as a hyperlordosis or too much lordosis, what it can mean is that the muscles whose job it is to flatten your back or tuck your tail may be a little weak, and they are allowing the sway to run unchecked. Now, that is bad for other reasons. In that case, the extra curvature is just a symptom of something that we can then fix and give you better support and protection. And if you do have a little extra curve in your low back, what I do with my patients is first, I'll check them to make sure that their lower abdominal muscles, whose job it is to flatten their back, are strong enough to do that. Because if they're not, they can allow that sway to run unchecked. And it can give you things like morning back stiffness, or trouble putting on pants and shoes and socks. Or if you're in the gym or exercising, things like squats may make your back really stiff and tight and sore afterwards, or even sometimes give you some back pain during. So basically, all we're trying to do is make sure that the chain of moving parts, that is your spine, is able to move freely and in a safe way. So if you do have a little, let me say this too. So if you have a little extra booty, a little bit bigger behind, it can make the curve in your low back look bigger more pronounced than it actually is, because once your spine ends, it continues outward with the rounded shape of your buttock. So if you do have a little extra behind happening, and it looks like your curve is too big, it may not, in fact, be that way. But if you're having back pain or other symptoms, especially if they're kind of progressing or they're not going away with standard treatment, it would be worth talking to a physical therapist or a chiropractor, someone who's familiar with the techniques we use to restore a normal curve and make sure that your back is well protected. So anyway, I hope that's dispelled some fears. A swayback is not automatically a bad thing. If you are having back pain along with that, or it's worsening as time goes by, definitely get yourself checked out. But other than that, live with it, enjoy it, it's you. Thanks for watching. Hope that's helpful. If so, subscribe below. And again, as always, if you have a question of your own that you'd like me to answer, leave that in a comment, and I would like to get back to you with a personalized video answer. See you guys next time.